This is our presentation on Vietnamese culture and the way that it affects healthcare. Here's some basic information about Vietnam. Vietnam is predominantly of the Buddhist religion and faith. Family is very important to both religion and culture. And Vietnamese typically believe in whole person health, which involves physical, spiritual, and emotional well-being in order to heal an individual. The Vietnamese language is a language spoken in Vietnam and by Vietnamese. Some specifics about Vietnamese health beliefs include, here it talks about health beliefs that overlap. Spiritually, they can believe that sickness is due to sorcery or evil spirits, or it can be due to an imbalance or disharmony in their life, such as too much hot or cold. And there is also the Western version of germ theory. But as stated before, practitioners will use methods relating to all aspects of health, including physical, emotional, and spiritual, in trying to heal a person. And some healing rituals used in Vietnam include chanting, potions, and amulets. And the Vietnamese core cultural values are based on Confucian ideals. For serious illnesses, Buddhist monks are called into the homes to pray and to burn incense. Mental illness is not viewed as an issue. They believe those to be more spiritual. Once again, that would be a time when Buddhist monks would be called in, and there would be lots of praying involved in incense, tying into the whole spiritual well-being aspect of their beliefs in regards to health. There's also the belief in balance, in having the harmony of yin and yang, and having the balance of hot and cold in life through diet and what is eaten and ingested, in maintaining that balance in life to help cure ills and give them a sense of direction. Some traditional remedies used by the Vietnamese include moxibustion, which is basically acupuncture with herbs that are ignited, and it's believed that the heat and the herbs travel down the needle and into the body. There's also coining, where a folk healer scrapes a coin on the skin, and this is believed to help release the bad wind. And cupping is also used in traditional healing, where heated glass cups are placed on the skin. This is believed to help create suction and increase the blood flow to help a person heal. Some big disparities in healthcare for Vietnamese Americans include language. There are many people who don't speak English or don't speak it well, and without interpretive services or people around who can help translate, they are not able to understand what is being taught to them or discussed. There's also, because of their strong cultural beliefs, Western medicine typically doesn't involve spiritual beliefs and focuses more on germ theory, and this can cause them to have a struggle of feeling that they're receiving the culturally competent care. There have been studies that have shown and found that Vietnamese actually try to only tell the traditional Western medicine doctors about what they're doing that follows their care, and then they talk to their traditional doctors only about the traditional things they're doing, because they're worried about causing conflict between the two. So we need to be more welcoming to what they prefer to do. There's also issues with where they might have a lack of insurance or unable to afford health care. In Vietnam, it wasn't uncommon that only the wealthy were able to travel to see doctors in clinics or hospitals. That's why they had traditional medicine healers in towns. And things to remember that are important for us is that Vietnamese believe that medicine should treat an illness right away, and they believe that it only needs to relieve the symptoms. So when their symptoms are gone, they believe that they're cured and will stop taking medication. This would be an important teaching opportunity to help them understand that they need to complete full antibiotic regimens, because just once they start feeling better, they still need to complete them in order to make sure that the germ is gone all the way. They can also be really hesitant about using any opioid medication because of the taboo and fears associated with their culture. So we need to be open to seeing what they are willing to use and feel comfortable with. For specific age-related healthcare issues, for Vietnamese women of childbearing age, prenatal care is actually lacking in rural areas of Vietnam, because as stated before, it takes money to travel into the city to go to a clinic or hospital. Generally, Vietnamese women have a lower BMI and smaller gestational weight gain, which means that they have a lower incidence of gestational diabetes. But because of their small body size, cesarean deliveries are more common in Vietnam. With their belief in hot and cold and balance, a typical acceptable diet for a pregnant woman includes poultry, fish, pork, ripe fruits, vegetables, rice, chicken, eggs, and ginseng. Physical activity is also encouraged, and believe that if they lay still for too long, it can actually prevent the fetus from growing. Sexual relations are not encouraged while pregnant, as they believe that it can cause damage to the baby, and they have a strong belief in the peri area being really dirty because of sexual activity, urination, and menstruation. So while pregnant women do their best at trying to uphold cleanliness to prevent infection, after having a baby, because of the balance and hot and cold theory, they may refuse to bathe or drink cold beverages or wash their hair postpartum because they don't want to upset that balance. And traditionally, Vietnamese women used herbs to wash the mother and child after birth. And breastfeeding is also very big for Vietnamese culture. For children who are 0 to 17, it's really important to understand that the family unit is so highly valued. There's a strong sense of duty among family members to each other, and the family unit is actually viewed above the individual. So typically with anyone, but especially children, the adults will make all the decisions for them for healthcare, for what benefits them and the family the best. Children and child rearing is viewed as a great blessing that involves all of the family members. So when there is a sick child, there might be lots of family involved between the parents, grandparents, aunts, and uncles. We need to be, as healthcare providers, aware of this and understand that a child could have great anxiety by being separated from family. So we need to do our best at explaining the visitation policy of the facility and helping the family being able to visit the child as much as possible. Vietnamese also have a great respect for their elders, which is part of, and they believe in hierarchy within the family, so that the older males typically make the decisions. It's common in traditional Vietnamese culture that they use strict discipline with children because of this belief that the elders are well respected. It is just part of their culture that children are expected to respect their elders and listen to their parents, and if they don't, physical punishment can be used to discipline them. This is not viewed as a form of abuse and would be related to spanking in this country. So if we see a child come in who might have a bruise, we need to be careful and not just jump to assumptions, and talk carefully with the child and the parents to help understand the situation. For adults who are 18 to 64 years of age, this population can be really susceptible to chronic illnesses such as cancer, heart disease, stroke, hypertension, and diabetes. They also have the health concerns of cardiovascular disease, obesity, tuberculosis, hepatitis B, and they have, unlike the younger children who might be adjusting to our culture with greater ease, the older generations can have problems with adjusting to the culture, blending their culture with Western culture, which can create conflicts within healthcare and their emotional identity. Also, there will be people within this age group who could possibly be children of American soldiers, which can cause them to have emotional and identity issues. And we need to remember once again that decisions are made involving the entire family and not just focused on the individual. For elders who are 65 years and older, this is the generation of Vietnamese who will have the hardest time with acculturation because they are elderly. They typically don't speak English because they are older and it's harder to learn a new language. And they will be more likely to hold the strong values and culture of Vietnamese. So they can have big issues with the cultural and language barriers in healthcare. It's really important as healthcare providers to make sure that we are providing interpreters for these individuals so that they can understand all the teaching that we are trying to provide to them, that we do our best at being aware of their cultural beliefs, not judgmental, and accepting of the different things that they believe while they're trying to help themselves and be healthy. And there's also this widening generational gap with the younger adults who are being more accepting of Western culture and the older adults who are still stuck in the old culture. In that, since the traditional Vietnamese have such a strong family unit and feel the great need to take care of each other, so when children would get older, they would take care of their parents. That was just part of their duty. But in Western culture, while that still happens, it's also more common for elderly to go to skilled nursing facilities to be cared for, which is something that can cause conflict between the older and younger generation of Vietnamese people while they're trying to work through these different cultural norms. In summary, as healthcare professionals, we need to remember that the family unit is highly valued in Vietnamese culture and that health and well-being are very family-oriented. So whole families can be involved in the care of one individual. So we need to make sure that our health services are more family-oriented than patient-oriented so that all of the family can be taught, not just the patient, and understand that family is very important to the individual's well-being. The Vietnamese hold great respect for their elders, so we need to understand that elders will most likely be making the final decisions on healthcare, not necessarily the patient. And finally, we need to make sure that we're providing culturally competent and respectful care of their different values, use of traditional medicine as well as modern medicine, and provide interpreters as needed to help increase their understanding and education. And our last few slides are our list of references that we have used for this information. Thank you for listening to our presentation, and I hope you learned some great things.